Hello everyone, this is Dr. Abdulaziz. I'm a physician in Mombasa, town of Kenya. I'm also a trainee doing the postgraduate diploma in diabetes. I'm glad you're watching this video. So macrovascular complications are common complications in diabetes mellitus. Actually, they are commonest causes of death in these patients. They present commonly as stroke and also as heart attacks, but also can present as peripheral arterial disease, where large vessels in arteries in the legs can be involved. For patients who have diabetes mellitus, it's important that they try to reduce their risks of getting these complications. So the first way how to prevent this is if you are type 1 diabetic, is to make sure early on during when you are diagnosed with diabetes mellitus, is to try and have your glucose well controlled. This has been shown in several large studies that early on tight glycemic control reduces your risk of getting these complications later on. And this is usually achieved by getting to target where your HbA1cs as agreed and early on by your doctor, you get to the target which has been mutually agreed by you and your doctor. And this usually by following nutrition therapy, compliance to medication, and also to follow up by your doctor. The second way you can reduce the macrovascular complications is use of newer anti-diabetic drugs. This applies to type 2 diabetics where they have been shown to reduce your incidence of getting macrovascular complications. Previously, anti-diabetic drugs were only used to lower blood glucose levels, but currently there are certain new drugs like SGLT2 inhibitors and GLP-1 agonist which have been used and have been shown in studies to reduce your incidence of getting complications from macrovascular disease. Third is to make sure your blood pressure levels are achieved less than 140/90. As we know, like diabetes mellitus, increases your risk of getting high blood pressure, and it's important that you make sure your pressure is less than 140 and systolic and 90 diastolic, so that you reduce your risk of getting macrovascular complications. ACE inhibitors and ARBs are classes of drugs which are usually used commonly in diabetes mellitus patients who have high blood pressure, because they reduce kidney damage, and other drugs as well can be used so that to reduce your risk of macrovascular complications. Diabetes patients also have high cholesterol levels and other lipid abnormalities. For most patients who are diabetic, it's important to have their lipid test checked by the doctor, and if found to have high levels of cholesterol, then statins will be indicated. For most patients with diabetes above the age of 40, they usually require statin therapy to help them reduce their risk of getting heart attack and stroke. There are also other treatment options for patients who cannot, their cholesterol cannot be reduced to target by statins. Is use of other drugs like ezetimibe, PCSK9 inhibitors, and also for those who have high triglyceride levels, is to use of the icosapent ethyl medications. The fifth way of reducing your chances of getting macrovascular complications if you're diabetic is to stop smoking in case you are a smoker. As we know, like smoking usually leads to accelerated atherosclerosis, and by reducing smoking and stopping smoking, you are reducing your chances of getting complications including heart attack and stroke. You can see your doctor who can help you to reduce, if you can't stop smoking on your own, by using counseling methods and also medications like nicotine replacement therapies. Yeah, the sixth way where you can use is the aspirin use. This is important, especially for those who have had a prior complication, like they have had a heart attack, they have angina, they have chest pain, or they have had prior stroke, and they are diabetic. These are patients who need to take aspirin as secondary prevention to prevent any other event later on. For those who have not had an event, you can see your primary physician, who can advise you if you need to take aspirin therapy. The seventh way in this video is to help you reduce your macrovascular complications. It relates to your diet. As diet is very important, your diet should be reduced calories, should be reduced fat content, especially saturated fats, should be low in salt, and this combination of diets can be found like Mediterranean diet and the DASH diet, which can be used and have been shown to reduce these complications. The last way of reducing macrovascular complications is exercise. You need to be physically active. You need to involve yourself in aerobic moderate intensity exercises, at least 30 minutes for 3 to 4 times in a week, and also resistant exercises twice a week. And also, especially if you can reduce your weight, then this can help you to reduce your macrovascular risk. So this is the end of the video, and I want to conclude by saying that diabetes mellitus, it's usually a high risk condition for macrovascular complications, and ways to reduce this risk include having good glucose and blood pressure control, treatment of lipid abnormalities including high cholesterol, healthy eating, and exercise. Regular exercise, use of aspirin and certain anti-diabetic drugs like empagliflozin or liraglutide may be indicated, especially once you see your doctor. Thank you. These are my references, and thank you very much for joining with me.